Now, access to care, again, setting the stage, has been defined in a number of ways. Obtaining appropriate and timely care to preserve or improve health. It's the opportunity to receive care, and there are a number of barriers to the receipt of care as well. Access to care can be measured in any number of ways, and these are just some of the examples in which access to care is measured. We'll talk more about access to care. Now, part of framing the discussion also is how we think about health and where we fit into health. And I'm sharing this construct with you because it'll help you understand the comments to come. If we think about this as a Venn diagram, health would be the large circle. Within health is oral health, as I've addressed previously. And within oral health, there's dentistry. Now, the size and the dimensions of the circles is just my own construct. I'm sort of a default to the computer programming here, but you can play around with these circles and sizes however you see fit. But there's another aspect that we also have to consider: business. When you play around with this Venn diagram, and I encourage you each to maybe do that on your own, because your construct and how you see this may be quite different than mine. But you have business, and there's clearly an overlap with health. Now again, I don't claim that this is the overlap. This is just how it came out when I did it. If I did it by hand, I'd probably draw it a little differently, but I think the point is still comes across clearly. Within health is dentistry. And it obviously has an overlap with business. And with dentistry, there's oral health, which has an overlap with health, and it's still within the construct of business. It is this Venn diagram that we struggle with as a profession mightily. And again, I encourage each of you to play around with this concept, play around with these circles, because as you do, there are some revelations that I think you can find on your own. Now, I'm going to also, in setting the framework, none of these numbers are important, but I think it's important just to provide a demographic framework for my comments. The numbers are not exactly up to date, so each one is a little larger. But we have well over 300 million people in the United States. About 46 million of them are below the poverty line. And these are pre-Affordable Care Act numbers. But at that time, 48 million lacked health insurance. Most of that group were from working families, and you see a significant proportion of children.